Well, hello everybody, and welcome to my discussion on CBD oil. There is so much information out there and so much misinformation out there that I've been asked by numerous patients and mamas to talk about this really important topic, clarify what it is, where it comes from, how to buy it, how to select where you get it from. Definitely not the local gas station, honestly. First thing we must understand is that in every human being, there is the endocannabinoid system. Say what? Okay, so I went to med school, right? Not that long ago. All right, so like 20 years ago. Never heard of this. So this is a system of receptors in our body that regulates sleep, hormones, appetite, nausea, vomiting, mood, and I can go on and on. The NIH had a nice little blurb written about it in 2009. It's 2019. Just learn about it. The endocannabinoid system is composed of two receptors, CB1, CB2. This is really important in understanding the differences between marijuana and the hemp plant and THC and CBD. As you'll notice in the graph, and if you forgot, you can always flip back and forth, and this is why I thought Instagram Stories is better than Instagram Live, so it can go back and forth on the slides. You may ask, why didn't I do a webinar? I also think flipping back and forth from this is much easier, and I also don't like doing webinars. Anyway, I digress. So, back to the point at hand. When we look at the receptors, we will see that CB1 receptors are concentrated and found pretty much only in the brain, where CB2 receptors are found a little bit in the brain, but really mostly in the peripheral tissues and our other organs. This is really important because THC, which is what is in marijuana, it is a psychoactive substance, binds strongly to CB1 receptors, where CBD binds to CB1 and CB2. Why is this important? Is because THC is a psychoactive compound and it binds only to CB1 receptors, which are found only in the brain. Psychoactive compounds means that THC can cause delusions, anxiety, irritability, hyperalertness, etc. I know. When people say that they have delusions from marijuana, is most likely because the marijuana was laced with another drug. Stop taking your advice from drug dealers and your friends. THC is medically known to be a psychoactive substance, which means it causes the symptoms that I just illustrated. CBD in marijuana binds to the CB1 receptors, therefore decreasing the risk of getting these psychoactive symptoms. THC is the reason why I'm going to do a sidebar right now on marijuana, not because I'm promoting it, people, because I want to debunk a couple myths. And one of them is that in the past, when the marijuana plants were processed, they had less THC and more CBD. These days, the pure marijuana plants have high levels of THC and low levels of CBD, which translates into a lot more people having side effects from smoking pot, from psychoactive effects of THC, like we talked about, and more people saying that their drugs are being laced with other drugs, which is very possible. But what I'm saying is the THC content of the more pure marijuana is so high that it's causing more side effects because the CBD content is so low. So proceed with caution. All right, back to the topic at hand. CBD and marijuana do not come from the same plant. Marijuana is extracted from a different species of cannabis plants, where the CBD oil that we use in medical practice is extracted from a hemp plant from the cannabis family. I'm going to show you a slide to explain it a little bit better. I hope the slides made sense because CBD oil and marijuana come from two different plants, and that's really important as we move through our discussion. CBD is not just one thing. There are about 113 different varieties of CBD coming from the hemp plant. Also, the hemp flower contains a little bit of THC, but it's less than 0.3%. And that's how, let's talk legality. We know marijuana is not federally legal. It is legal in some states like Colorado, but it is not legal in North Carolina. So what's up with CBD? Well, the Farm Bill, which was passed in August of 2018, said that CBD oil extracted from hemp plants that contain less than 0.3% of THC are now deemed legal. So that's why CBD oil has become a hot commodity in Charlotte, North Carolina in the past recent months. Okay, great. We got into the nitty-gritty stuff of legality. We talked about the receptors, the endocannabinoid system. Spell that. It's a good spelling bee word. Now, let's dig a little deeper into how do you select a CBD oil. Now, we know number one rule, we're not going to get it from the gas station or random vendors without doing your due diligence. My gosh, people, we do due diligence on everything. All I have to say right now is vaccines. And everybody's like, oh, I've done my research and like thousands of binders are popping up. And CBD oil is like, oh, it's no big deal. I'm just going to get it from my neighborhood store. Are you kidding me? Like, no, just because it says natural and comes from a flower does not mean we're just going to get up and go buy it because our friend had really awesome results with whatever random tincture they have. No. If you ever hear that something has no side effects, you're going to turn the other way and run because that doesn't exist. Even water. Water has side effects. Too much water can cause seizures. Too much salt can cause high blood pressure. Too much sugar, we're not getting into that. But you know what I'm saying. So we're going to get to the side effects in just a moment. But let's look and see how we should select where we get our CBD oil from. Because it is the wild, wild west out there, the FDA does not regulate CBD oil, and every person is now selling it, as we discussed. What you need is called certificate of analysis. Anytime somebody gives you a little tincture, you're going to say, what is the certificate of analysis? What is a certificate of analysis? What the proper company does is they get a third-party provider to verify that, number one, the amount of CBD in the bottle is what it says on the label. Number two, we need to make sure that there's no herbicides, pesticides, or chemicals in this tincture. The hemp plant absorbs everything from the soil. So just because a company says, we grow our plants organically and we don't use herbicide and pesticides, that means nothing to me because hemp plants. So it's important because here's a little scenario. CBD oil is a hot commodity. Big money, people, right? Everyone's selling it. But this is what's happened. Some farmers who were not doing well with their crops, which they were spraying with Roundup, herbicides and pesticide, etc., and not treating their soil right, are now growing hemp plants. Well, they're not using herbicide and pesticides on the hemp plant currently, but the soil is laden with herbicides and pesticides because we know these things leach into the soil and the water supply, and this plant is so sensitive and absorbs everything. That's why the certificate of analysis needs to have this outlined. Other things in the certificate of analysis needs to be an investigation if there's any bacterial contamination. I let that speak for itself. Cool. Here's another little tidbit. So the company says it's evaluated by a third party. Be careful you know who the third party is, because what they've done is they may name a third party, and the third party has a similar address as the company who's claiming that they're getting a third party inspection. So much fraud. That's why you need to get your stuff from a provider that knows what they're talking about. Other things in the certificate of analysis needs to be an investigation if there's any bacterial contamination. I let that speak for itself. Cool. Here's another little tidbit. So the company says it's evaluated by a third party. be careful you know who the third party is, because what they've done is they may name a third party, and the third party has a similar address as the company who's claiming that they're getting a third party inspection. So much fraud. That's why you need to get your stuff from a provider that knows what they're talking about. Before I show you a couple of examples of certificate of analysis for you to get an idea of what I'm saying, the thing to understand is that there's companies that sell isolates, which means that the product has only one type of cannabinoid in it. Remember, we said there's 113 types. And then you have the broad spectrum, which has a variety of different cannabinoid species in it. What we're finding is that the broad spectrums works better in some, and the isolate does work better in others. So it is a trial and error kind of thing, because there's no blood work, but what I'm letting you know is that there's a difference between isolates and broad spectrum. The question we often get is, well, but we've heard that having a higher level of THC than 0.3% will improve the effectiveness of the CBD oil. The medical literature is not currently supporting that, and it's not legal in the state, so we don't even have anything to talk about it. Okay, cool. Let's look at a couple COAs and see the difference. That certificate of analysis did not have any indication of any herbicides or pesticides on it. It is an isolate. It didn't have who did the certificate of analysis, what the address was, name, and such. You need to pay attention. Okay, we went through all that. So what does the medical literature say? The medical literature does identify the endocannabinoid system with thousands of literature studies. CBD oil was only passed as legal since August of 2018. So when you hear that there's thousands of articles saying that CBD has all these properties and effects, proceed with skepticism. There are lots of data in animal models because it's legal to use it in animals. There's just not a lot of data in human studies because of the aforementioned legal problems. In children, there's only a few studies, and specifically for epilepsy and Dravet syndrome, because this is how medical marijuana got its claim to fame in the pediatric population. So I found a couple of studies in seizures, as I said, some Dravet, a couple autism, some people with dysautonomia after immunizations, so not a whole lot. In adults, the literature does support treatment for anxiety, depression, insomnia, and drug addiction. Actually, tremendous studies are shown to help people get off their drug addiction using CBD oil, so that's awesome. Oh, the other thing is chronic pain. A lot of studies are done on chronic pain in adults. The data in children is lacking. It usually is lacking in kids because no one wants to experiment on children. So what are the side effects? The main side effect is going to be drowsiness and sleepiness, especially seen in children who have seizure disorder, because in order to stop the seizures, sometimes we have to use high doses of CBD to stop the seizures, which makes the kids really sleepy. So tiredness and too much somnolence is the number one. There is documented evidence of irritability, stomach pain, and nausea from the CBD oil, which, like anything, has side effects. We're not surprised. So anyway, I hope this helps. Have fun looking at the data. There's lots of information out there, as I said, in adults. They're not tons, but there is some great data coming on the stuff I already talked about. I did forget about multiple sclerosis, Parkinson's disease. Those are also some good stuff. There was one small study done on acne, and it's very specific on which cannabinoid works for acne and which one doesn't, because again, not all of them are created equal. What I'm saying is the studies are just beginning. Be on the lookout for more information coming. Beware that there's side effects. I think I forgot to mention that there could also be diarrhea. And again, not horrible, but we need to know that there are side effects. Proceed with caution. The most important thing I can let you know, be very educated before you dose this to your children, preferably with the help of a provider.